your new patient numbers have been stagnant and you've already tapped out referrals, it's time to start generating new leads online. But in 2024, internet lead costs are at an all-time high, especially for dental. So how can practices continue to grow without burning all of their profits on rising costs? Now, my team and I, this year alone, we work with 70 different dental practices across the entire states. And the largest difference between the practices that flounder for new patients and the practices that are thriving comes down to one single thing, and that's new lead follow-up. That's right, it's not just about paying more for more leads, it's about capitalizing better on the leads you're already paying for. And in this video, we're gonna cover the top 5 tips your office can implement today to start turning more of those leads into actual booked appointments. Now, these are the same tips that not only our top performing practices use, but that we personally use for our in-house follow-up team. So let's dive into the first tip, and that is speed to lead. Probably the number one factor in your ability to get a hold of these leads is how quickly you reach out to them. In this graph from Harvard Business Review, it indicates that the chances of converting a lead drops off dramatically after just 5 to 10 minutes. Now, our personal data based off of dental specifically tells a similar story. While it may not be as dramatic as 5 minutes, getting to your leads in the same day that they come in is critical. Except for weekends, of course, we want a little bit of balance. Our recommendation is to have one person who's ultimately responsible for all your new leads. This person should have an easy to manage place to see all their leads in once and also receive notifications when a new one comes in. So let's go to tip number 2. Most offices are surprised by how many attempts and how much work it takes to get a hold of these leads. But it's important for us to have some perspective and remember that these leads, they don't know your practice yet. They don't know how amazing you guys are. These leads, they also have plenty of other options. And people in general, they live busy and distracted lives. So giving up after just one try or one call is really leaving a lot of money on the table for your practice. We've tested too many follow-up strategies to count, but the simplest and most effective method that we found is doing 3 contact attempts over the course of 3 days. Mostly phone calls, but with some text message and some voicemails thrown in. So an example of what that could look like. On day 1, you give that lead a call right away, right? And then afterwards, shoot them a text message, hey, this is why I'm calling XYZ. On day 2, give them another text message, right? Here's a scheduling link, here's the offer. On day 3, one more phone call and then leave a voice message after. It may seem like we're over communicating or bothering them, and that may be the case once they're already a patient. But in this early phase, we want the most touch points as possible. It's really critical to get a hold of them. One bonus idea that we use is whenever calling these guys, do a double call. That literally means if you call, if they don't pick up, just dial them right back. It helps with pickup rates a lot. So now let's go into tip number 3, which is the greeting. How do we actually talk with these leads once we get them on the phone? Now, before a few things to keep in mind, kind of with the script as a whole, not just the greeting, is attitude trumps everything, right? Probably the biggest factor in getting these patients to schedule and show comes down to attitude. Number 2 is agreement is key, right? To the best extent possible, we want to agree with them, reassure them, be quick. Phrases like, yes, I totally understand. I'm glad you called. You made the right decision. We can help with that. Yes, absolutely. Right? Just having that tone really goes a long way to building confidence and just showing them, okay, I made the right decision. Now, when we call these leads, there's 4 things that they're thinking. Who is this? Why are you calling me? How do you get my information? And what are you going to do for me? Right? So here's a quick variation of a script that answers all of that within the course of 10 seconds. So first we call them, hi, say the lead name, is this John? Yeah, this is John. Hi, this is Dominique from Lake Stevens Dental. The reason I'm calling is that you submitted a form to be contacted by us for our new patient special. What other information can I get for you today on that? Right, so real quickly we answer all of those questions and go into, right, what can we offer them? Now, kind of regardless of what they say, we want to say, great, absolutely, I can help with that, or the doctor can help with that. Do you mind if I just ask a couple of quick questions? Right, so instead of going straight to the booking, we want to go a little bit deeper into what do they care about? Also, one quick tip for the greeting: if you're gonna practice anything, script it, it's the greeting. You wanna keep that concise, smooth, and confident. Right, so now we've done the greeting, let's go into tip number 4, or really step number 4, which is fact finding. Now, to get more of these leads to schedule, we need to tailor the conversation to what they care about. We do this by asking quality questions and getting quality answers. This is called finding the DBM, or dominant buying motive. We want to first understand more about them, right? What are they looking for? What do they value? Why now? If someone's main concern is price, we don't want to go on and on about how we make the visit pain-free and comfortable. If someone's main concern is anxiety, we don't want to go on and on, focusing on how we have everything under one roof or the highest technology. Understanding the DBM allows us to focus the conversation on what they value and why they would want to schedule with your office. Below here are a few examples of some fact-finding questions that we use every day. Right? What's the main concern with your teeth right now? Do you have any pain? How has this affected your day-to-day life? Do you have any outstanding situation, or were you just interested in a regular checkup? Right? Have you had this looked at before? Have you gone to a dentist before? Right? What's the most important thing to you when considering a new dentist? Why have you decided to do something about this now? These are all different questions that will kind of drum up what's actually going on so we can understand more about them. Okay, now that we have a good idea of the DBM, or their dominant buying motive, we want to have a quick spiel ready to go. Think of it like a bridge that connects their concerns and values to the appointment that you want to schedule with them. We call this value building, and that's tip number 5. So let's have an example situation. We ask some of those questions, and it turns out they haven't been to the dentist in years, they're a little anxious, a little hesitant, they don't really know what they need, but they are wanting to get their oral health back on track. We might say something like this: well, first off, congratulations on making the decision to take care of your oral health. It's such an important part of your overall well-being. Here at our dental practice, we're a judgment-free zone. We have multiple sedation options for any kind of patients who feel uncomfortable at the dentist. We also offer comprehensive care for any of your dental needs, but our doctor never pushes treatment if you don't need it, right? Saying something like this, we're focused on kind of where they're coming from, right? And then we could proceed to schedule. Doing this first, or having this little bridge, is really going to increase the chance that they actually schedule and actually show, right? So those are the top 5 tips. And at the end of the day, if you want to tap into the market of new patients that don't really know who you are yet, you ultimately have 2 options, right? Buy more leads or convert more of the leads that you're already buying. And if you and your team can master the 5 tips that we just mentioned above, I guarantee your schedule rate, appointment rate, show rate is going to skyrocket. So I hope you can implement those. Happy hunting. And if you ever need any support on this, we're here to help.